Did you know the #1 reason people lose their teeth isn't cavities, and it isn't genetic? It's actually gum disease. Now, the thing is, gum disease doesn't just affect your teeth. It also affects your whole body. I actually made another video talking about the other diseases that are linked with gum disease. If you want to watch that, I'm putting a link in the description below where you can check it out. So that being said, if we know that gum disease is so bad, it's not just affecting your mouth, that it can affect your whole body, then it's definitely something that you'd be wanting to fix. Because if you do not have a healthy mouth, then it is impossible to have a healthy body. So how do you know you have gum disease? Other than you going to the dentist, them poking around your gums, and then saying, yep, you got gum disease. The #1 sign of gum disease is inflammation. And inflammation can present itself in different ways, but the easiest way to tell is if your gums are bleeding. Now, why do your gums bleed? So you have these bacteria that are hanging around your teeth and gums, and they're not getting cleaned away. When they don't get cleaned away, then your immune system has to respond. Just like bacteria in different parts of your body, your immune system will react and start to fight off these bacteria. In turn, you get more blood supply. Anytime you get more of this immune system respond, that's when you get more of the inflammation. That's when you get more of that blood supply. So that blood is basically already in that area. This is why when you start to touch your gums or floss that area or brush your teeth, why your gums bleed. A lot of people tell me that they don't floss anymore or they don't brush as much now because every time they do, their gums bleed. And I'm like, oh my God, no, that's the opposite of what you're supposed to be doing. Because that means that your gums are really inflamed. And when your gums are really inflamed, they need to be cleaned. And if they're not clean, they're gonna keep on bleeding and keep getting more inflamed. Usually it'll take a couple weeks of consistently cleaning that plaque and bacteria off your teeth and gums for that bleeding to stop. So don't be startled next time you floss your teeth or brush your teeth. If they start to bleed, that means you should keep doing it. But eventually that bleeding should stop. Ideally, when you brush and floss, your gums should never bleed at all because bleeding gums is never normal. And when you have bleeding gums, it usually means that, like I said, you have that gum disease, or it could mean that you're just not brushing and flossing correctly, or you have something else that's persistent that's going on, which again should mean that you should go to the dentist and get it checked out. I think regardless, if you have bleeding gums, or even if it's been a while, you should go to the dentist. But let's say you don't want to rely on bleeding gums to check, or you want to double check if you have gum disease. Well, some other signs of this gum inflammation are having puffy gums or more red looking gums or having some swollen looking gums. You could also have bad breath, but that could just be a number of other reasons. It could be that garlic and onions you had for lunch. So the most accurate way to tell at home if you have gum disease, again, is gonna be the bleeding gums. Because those other signs of gum inflammation, it can be a little subjective if you're at home, if you're not a trained professional actually looking at the gums. Because also depending on your race, you might have different pigments in your gums naturally, so it might appear more red, but it could just be healthy for you. So not everybody's healthy gums will look the same. So if you've been dealing with bleeding gums or wanna fix your gum disease at home, then this video is for you. Now, side note, I know I mentioned this does not take away from you going to the dentist and getting your teeth clean and getting your teeth and gums checked. And also, second side note, some forms of gum disease are more severe and they're completely impossible to fix at home by yourself and you need a professional to help you fix it. So for the sake of this video, I'm mainly talking about gingivitis, which is a mild form of gum disease. But when that gum disease gets more severe, it turns into something called periodontitis. And this is when you need to go get it corrected with the help of a professional. Now I'm gonna get into that more in detail in the later part of this video, so make sure you stick around for that too. So the first way to reverse your gum disease, I know I already talked about that, is gonna be the mechanical removal of the plaque and bacteria on your teeth. And this means brushing and flossing correctly, and potentially even using a water pick or water flosser or something like that. When you brush and floss, you're removing plaque from your teeth. So plaque is basically this biofilm of bacteria that get attached to your teeth. Now, it's not really strongly attached, it's really loose. So if you touch it, like for example with your fingernail, I know that's really disgusting, but it should be able to come off pretty easily. And this is something that should be removed regularly when you brush and floss. If you brush and floss correctly, you shouldn't have this plaque build up on your teeth. Now, sometimes this plaque will turn into tartar. Now, this tartar is when this biofilm of bacteria also gets calcified and mineralized. And this is when it really gets stuck to your teeth. And this is something that brushing and flossing will not remove because it's not loosely attached anymore. It's actually really hard to remove it. This is something that can only be removed by a dentist or a dental hygienist. Now, some people are just more prone to getting tartar than others. Even if you brush and floss your teeth correctly. So it depends on your diet, your saliva, a lot of things. And some people just have more of this buildup on their teeth that they have to go to the dentist to get removed. Having more tartar doesn't always mean that you have uncontrolled gum disease. So for most people, they can resolve their gum disease with just this mechanical debridement alone. So brushing and flossing correctly, and also using a water flosser. You don't have to use a water flosser, but if you already have gum disease, I think it's a good idea to add on to your brushing and flossing so you can kind of flush out everything. And how will you know if your gum disease is resolved? Well, going back to what I said before, the easiest way to tell is if your gums don't bleed anymore when you're brushing and flossing. If 2 weeks ago when you brushed your teeth, your gums started to bleed or your bristles on your toothbrush looked red, but now you don't see any bleeding at all, and you open your mouth to kind of check your gums a little bit, and you don't see any bleeding, that's a great sign. But also, if your gums just look healthy, if they look less puffy, less swollen, less red, then those are good signs. Now I know I talked about how to brush and floss correctly. So with brushing, it depends if you're using an electric toothbrush or a manual toothbrush. I recommend always using an electric toothbrush. I just think they work a lot better and they're a lot easier. With the manual toothbrush, you're gonna want to angle that toothbrush at a 45-degree angle towards your gum line. So you don't wanna keep it flat, you wanna kind of angle it a little bit because your teeth kind of curve in as they approach your gum line. And then you're gonna wanna use soft circular motions on every single surface of your teeth. So you're gonna wanna get the cheek surfaces of all your teeth, the biting surfaces, and also the tongue surfaces of all your teeth. Now another tip when you're brushing your teeth, it also depends on the angle you're holding your toothbrush. I'm not talking about the 45-degree angle towards your gum line. I'm talking about the angle towards the front of your mouth versus the back of your mouth. Because sometimes you're missing the front parts of all your teeth. For example, if you're brushing with the handle of that toothbrush towards your cheek, then you're gonna be better at getting the back surfaces of those teeth. But you're gonna be neglecting the front surfaces of those teeth. And on the other hand, if you angle the handle of that toothbrush towards the front of your mouth, then you're gonna be better at getting the front surfaces of all your teeth, but you're gonna be neglecting the back surfaces. So keep in mind the angle of your toothbrush, not just up and down like that 45-degree angle towards your gum line, but also the angle towards the front and back of your mouth to make sure you're getting a full coverage cleaning of all your teeth. I know that can get a little confusing, so I hope that made sense. If you have to replay it to help understand it a little bit, that might help too. Now, when it comes to an electric toothbrush, the angling of the toothbrush is pretty much the same, whether you're angling it at a 45-degree angle or also when you angle the handle of the toothbrush, whether it's towards the front of your mouth or towards your cheek. But that's really all you gotta worry about with an electric toothbrush. Everything else is pretty simple. All you gotta do is just hold it against every single surface of every single tooth, because that electric toothbrush head will be doing all the work of cleaning your teeth. You don't want to be moving this electric toothbrush in circular motions because you're actually going to start to negate a lot of the benefits that you get from it. The other key thing with whether you're using a manual toothbrush or an electric toothbrush is not pushing too hard on your gums or your teeth. For most people, they're going to want to actually brush softer than they would initially think. A lot of people think brushing harder is better, but actually brushing softer will clean better and also cause less damage, because sometimes you can see gum recession or damage to people's enamel where they start to wear away some of their enamel and get these abrasion lesions because they're brushing way too hard. Now with flossing, you're gonna wanna do a technique called C-shaped flossing. It sounds more complicated than it actually is. Basically, you take that floss, and when you go in between your teeth, you don't want that floss to be straight. You actually want it to be curved towards one side of your tooth. And that's how it gets that C shape. And then you're gonna wanna go up and down a couple times, and you're gonna wanna even get that floss underneath your gums. And then you turn it towards the other tooth, and again, turn it to a C shape and get underneath the gums again. And you're gonna wanna do the same thing in between every single surface of your teeth. And if you can, even angle that toothbrush behind the very last tooth in your mouth and try to just clean that a little bit with the floss. That might be a little tricky, but even trying, I'll give you some points. And if you want to take it a step further by adding a water flosser, this will also help. I don't think a water flosser should completely replace your flossing, because the flossing, again, is that mechanical removal, and you just don't get that with a water flosser. But a water flosser is good because it can really flush out anything remaining in between your teeth. And this is also really good if you already have active gum disease because it'll really help control it. Now, how often should you be doing this? Brushing, I recommend at least doing twice a day, so once in the morning, once before you go to bed. Flossing and water flossing, you really only need to do one time a day, and I recommend doing that before you go to bed. Now, I know there's so many different things you already have to do a day. There's so many different routines you probably have to do. You probably have a workout, your stretching routine, etc. Now, adding a water flosser on top of all this is just gonna make it more difficult. So one tip I have with that is getting a portable one, because the portable ones you can even take in the shower. So then you can kind of combine doing two things at once, so you're not wasting more of your time throughout the day. Now, I do want to also make a quick point about oil pulling, because a lot of people ask me about that. I did make another video specifically about oil pulling in a different video, so I'm putting that link in the description below. Now, I think the thing with oil pulling is there's no real other benefit you get that you don't already get from brushing and flossing. So I don't think oil pulling can hurt you, but I also don't think you need to do it. We just don't have enough evidence to support it yet. Now, if you're wondering what even is oil pulling, well, again, you can check that video out below where I went over it in detail. Now, the second thing I'll mention is your diet. Now, a couple things with your diet. It's not just the food that you're eating, it's also the timing of your meals. So very first, you want to avoid foods that will create more plaque around your teeth and gums. So what foods will lead to more plaque? Well, it's the foods that will actually feed the bacteria in your mouth. The bacteria in your mouth love carbohydrates, and the less fiber, the better. Foods that are high in carbs and foods that stick to your teeth will create a field day for those bacteria in your mouth. So it's not just sugar, it's also starchy foods and sticky foods. So like potato chips or crackers or Cheez-Its, etc. These foods will all still feed those bacteria in your mouth and feed those bacteria on your teeth and gums. When you give these bacteria that food supply, it allows them to form this biofilm. You're basically giving all these homeless bacteria in your mouth a bunch of these resources where they can start to survive and thrive in your mouth. And it's kind of like leaving food out on a table. You know, at first it'll be clean, but eventually you're gonna start to see a bunch of fruit flies or ants or something else that's digging away at that food. If you don't have that food there, you won't get the bugs. It's the same concept with your mouth. So that's the first tip. Don't give these bacteria the food that they like. Don't give them the carbs, the starchy foods, the sticky foods that will allow them to be abundant. Now, I'm not saying to never eat these foods. I'm not saying to never have a cracker or potato chip ever again, because it also comes down to the timing of your meals. If you're gonna have these high carb, low fiber, these starchy foods, then you're gonna wanna at least time it correctly. The biggest thing is to avoid snacking. It's kind of like intermittent fasting in a way, because intermittent fasting in a way is actually really good for our teeth. If you wanna eat these foods that contribute to the plaque in your mouth, then you're gonna wanna at least time it with a meal. So if you're having some spaghetti for lunch, and then you also want to have a bag of potato chips, try to time that bag of potato chips around the time of that meal. Because when you have that meal, then you have more saliva in your mouth. Anytime you eat anything, more saliva builds up in your mouth. And that saliva is like a bodyguard for your teeth and gums because it has a lot of antibacterial properties, and it can also wash away a lot of the food and the plaque and bacteria. So that way, if you time that unhealthy snack with your meal, at least it's not gonna do as much damage to your gums and teeth. You can also try ending your meals with a tooth-friendly food. So what are these safe foods that I'm talking about? So it's foods that, first of all, do not cause gum disease or plaque buildup on your teeth. But it's also foods that can help clean your teeth. So these are gonna be things like those leafy greens or different vegetables, your fruits, your dairy products, and also nuts and seeds. In general, adding these foods to your diet is always gonna be beneficial for your teeth. Not just because they don't cause cavities and don't contribute to gum disease, but also because the crunchiness in them helps clean our teeth. Not so much the crunchiness in dairy products, that would be a little weird, but the other foods I was talking about. But also in a lot of these foods, you get a lot of the necessary vitamins to keep healthy teeth and gums. Now, a couple other things you can add to your diet that a lot of people probably do not know about are garlic and ginger. Both garlic and ginger have antibacterial and anti-inflammatory properties. And on top of that, they can help restore the pH in your mouth, because most foods make our mouth acidic, because a lot of these foods that are high in carbs, they'll feed the bacteria in our mouth. Those bacteria in turn will release lactic acid as a byproduct, and that can damage our teeth and gums as well. But also any beverage like Coke or coffee, etc., all of these will also be acidic and can lower the pH in our mouth. So that's another benefit you get from adding foods like garlic and ginger, because you can help balance out the pH. And also, garlic in particular has about 33 sulfur compounds in it, meaning that alone can help prevent plaque formation in the first place. So those are two of the biggest things. If you get your diet in order and if you get your oral hygiene regimen in order, you should really have healthy gums. But I think it's also really important to talk about smoking. If you don't smoke, great, you can skip this part if you want. But if you do smoke or you vape, or if you even use like a nicotine pouch like a Zyn or something like that, you'll want to stop that if you want to have healthy gums. In general, smoking will simply lower your immune system. It'll make it harder for your body to fight off infections and bacteria and also prevent gum disease. But on top of that, all of these products will cause irritation to your gums. Now again, in this video, I'm really only focusing on gum disease. There's a ton of literature showing the different cancers, including mouth cancer you can get from smoking cigarettes. I'm not going to talk about that in this video. But all of these products, even if they don't have nicotine in them, will still cause gum irritation. That gum irritation can over time lead to gum recession, where your gums start to get pulled back from your teeth. And that can also contribute to gum disease. Now, the last thing I want to talk about is when this gum disease gets so severe that you can't treat it at home. And this is, like I mentioned before, when it turns from gingivitis into periodontitis. Gingivitis means inflammation of your gums, meaning it only affects your gums. Once it gets to periodontitis, this is when it starts to affect the support structure of your teeth. So that means it gets below your gums and it starts to affect the bones that surround your teeth. So this is when you can start to get deeper pockets. You know, when you get to the dentist or the hygienist, they start measuring your gums with that dental probe and they start shouting out those numbers like a 2 or a 3, and you always wonder what those numbers mean. Well, those numbers are a measure of your gingival sulcus. Basically, you have your teeth in your bone and then your gums will be attached to your teeth. But then towards the surface of your tooth, there's a pocket around your tooth where your gums are not attached. And that pocket is that gingival sulcus where your dentist or your hygienist are measuring when they probe your gums. When your gums are healthy, that space should be shallow. It should only be between 1 and 3 millimeters. Those are really healthy numbers. But once that gum disease gets more severe, then that inflammation starts to spread below your gums and into your bone area. And then you can start to get bone loss, where you start to lose your bone. Or you can start to lose that attachment in your gums, where your gums are no longer attached to your teeth as much. So now that probing is going to be deeper because you start to lose that attachment from your gums. So now you can start to get a 4, 5, 6, even higher millimeter pocket, where that signifies that you have a more severe form of gum disease. If you leave this alone, then that inflammation is going to only keep getting worse. And no matter how much you brush and floss at home, you're not going to be able to reach that pocket. And if this continues, your teeth can start to get loose because you start to lose that bone. You can start to lose all your teeth, or you can get an infection, which can be really painful. So the way to fix that is going to your dentist and hygienist and potentially getting a deep cleaning done, which is where they start to clean deep underneath your gums to remove all that tartar and plaque buildup and remove that inflammation. Or you might even need a surgery done where they can access that area better and clean it really well. But it's really important that if your gum disease gets to this point that you get it corrected, because if you don't, then it's only gonna get worse. And once you lose that bone that surrounds your teeth, you can't get it back. It's irreversible. And this is when you can eventually lead to you losing all your teeth. But the good news is once you get that tartar and that plaque removed that's underneath your gums and you get this gum disease maintained again, then you can go back to doing your normal cleanings. And then you can go back to maintaining your gum disease at home and not letting it get to that point again. You're doing all the right things. You're going to the gym, you're getting a good workout in. So do you really need to get that protein shake after? Or can you just eat a normal meal and get on with it? And does the type of protein matter? Like, does it have to be a whey protein shake, or can it be something else? Can you just get your protein from your meal? Like, can you eat chicken or beef or something? Or can you eat